Hi everyone, welcome back to my channel. My name is Gemma, and what the fuck am I saying? Hello. Hi everyone, I'm sorry if I'm very awkward. I don't do a lot of sit-down videos. Most of my channel is vlogs. Anyway, so today I'm filming one of my most requested videos, which is my breast reduction story. So I will tell you about my experience with this procedure. I went from an H cup to a C cup. I'm currently a C cup now. I had this operation 2 years ago. I can give you a little bit of perspective on my experience. I also asked you guys to ask me some questions that you particularly want to know, so I'll go over that a little bit later. But first I'm just going to tell you the background as to why I felt I needed to get this done and what really motivated my choice. Just a little bit of background on my body type. I was always someone who was pretty athletic, but throughout puberty, as most of us do, I got a little bit rounder and my breasts started to come in, and they were relatively proportionate to my size and my weight up until college. They were always on the bigger side. I think when I left for college, I was probably already an F cup or an E cup, somewhere around there, but they really got a lot bigger throughout college. So I ended up with an H cup at about, I think I was probably 19 or 20. So around that same time, I had started to really develop a passion for weightlifting and going to the gym and working out. And throughout the spring of my junior year, I really got into it, and without really wanting to, it wasn't my goal to lose weight, but I ended up losing pretty much all the weight I'd put on during puberty. But what happened was, so my body was losing weight, my stomach, my legs, but my chest was staying exactly the same. And so this was my first clue that this was not due, that my breast size was not due to my weight anymore anyway. And I got very kind of frustrated and curious about it, and so that's when I finally kind of occurred to me that I could get a breast reduction. I had never thought of it before. And at first I was very upset doing research about it. I remember like crying when I found out like how it's done. So if you aren't familiar with like the scarring and the way that the breast is manipulated basically to be smaller, there is quite a bit of incision and cutting, and your breast is pushed upward. So essentially you end up with a anchor shape scar, which takes up a lot of your lower breast. And so reading this before having it done, obviously I was terrified, also very angry for some reason about how minimal the scarring is for breast augmentation. I was like, this isn't fair. People with little boobs don't even need to get augmentations, and they have no scarring, and I need to get a reduction, and I'm gonna have so much scarring and it's gonna be so ugly. And also obviously at that time I was also a little bit concerned about how this would translate to my intimate life, private life with partners, and being very scared of rejection with, you know, what if the boy I like is grossed out by my scars? Like, I was just so nervous about all of that. Spoiler alert, it turns out fine. It's not an issue at all. Then so over the next 6 months, going into senior year, I became very aware of my chest and body pain. I had always had back pain, but I never associated it with my chest because people always tell you that you'll have lower back problems when you have large boobs. And actually it's not true. I mean, maybe for some people they have lower back problems. For me, it was upper back and between my shoulder blades. So like neck and just between the shoulder blades was the worst. And I had never associated that pain with being due to my breast size. So anyway, so a few things clicked in my head, and so throughout my senior year, I remember, I'm sorry to my friends who had to hear me bitch about this for like a whole year, but talking with my friends and having a lot of just kind of body image awareness, body image, what we call that, revelations, really helped me to essentially decide that, oh my god, like, yes, like I still thought I was fat, and it turns out it was just that my chest was very big and making me seem a lot bigger. So for example, getting a dress for our senior prom, our senior, what do you call it, senior ball type thing, was so difficult because things fit my legs, my waist, but I couldn't get my boobs in any dresses. I remember I had a strappy dress and my shoulders were bleeding at the end of the night from the weight of my breasts. So this brings us to, I graduated college, still have the large boobs, and that summer I decided it's time. I don't have any plans for the fall, so I'm just gonna go for it. So I came back to France. So my family lives in France. I studied in the United States and started meeting with my doctors. So this brings us to one of the first questions, which is, how did I find my surgeon? So essentially, it depends on what country you live in. Obviously, there's different ways to find a surgeon. In France, and I think in a lot of countries, you need to get referred by your GP, by your general practitioner. So that's what I did. So I went to my GP, I explained to her what I just explained to you, that I lost weight, my boobs didn't get smaller, I'm really frustrated, it's a lot of pain on my back. And she agreed. She was like, yes, like, you know, you have a very small frame for your breast size, etc. So she gave me the name of a surgeon who I met with I think the following week, and I was very fortunate that I really trust my GP. So she was, I guess, just, she knew, or there might just not be a lot of surgeons who do this where I live. She directly referred me to the perfect surgeon for me. She was a woman. She had been doing breast reductions for, I don't even know how long, at least 10 years, maybe more. And she was very good listener and very well versed in what she did. So I did a lot of research before going, because I wanted to go in knowing what I was asking for, what I wanted to ask about. I asked her about scarring, surgical bras, I don't remember what this is called in English, but essentially after surgery you have drains. I think they're called drains. It's like a little tube that's in you to drain out excess blood and to avoid huge bruising, for example. So anyway, so I asked her all my questions. She answered all of them amazingly, and she basically scheduled me. She could have scheduled me for the next couple weeks. I asked to have at the end of the summer, because I still wanted to have the summer to reflect on it being real, not just a plan. So my initial tip with finding a surgeon is, so if you meet with one at first and you just have, you know, a bad feeling, bad vibes, don't be afraid to go get another recommendation. Also look on forums for your town. I remember looking, you know, breast reduction surgeon, the town where I live, and seeing what people said, and with the name of the surgeon I got as well. And if you're starting to see messages like, I didn't like my experience, I had to get a redo, just take that. I mean, if you're feeling comfortable and you see negative feedback online, there are other doctors, right? So make sure that that relationship is solid, that you trust your doctor. Also, very important, always ask to see before and after pictures of their patients. Obviously they're going to show you their best work, but I think it's really important to see what their best work looks like. If their best work is, you know, lopsided and with bad scarring, you can, you know, take that as clue number one, that you don't want to get operated on by them. But yes, also asking about age. So that was something that a few people asked me, how were you able to find one so young? Now, a lot of people wait until they're maybe 40, they have their kids, and which is fine, that's valid. Like, you know, it's a choice that you can make to have it later on in life. But to be honest, if you can get it done young, your recovery is going to be a lot better. You're just going to have a better quality of life if your breasts are something that's bothering you already when you're 19, 20, 21. I had mine done at 21. I'm 23 now. And my surgeon told me she had girls as young as 13 get breast reductions with her. So age doesn't really matter. If someone tells you that you can't get it done because you're too young, that's bullshit. You know, obviously there's going to be consequences on breastfeeding, so that's another question. Sorry, I'm just getting like blah. The questions was, were you worried about your ability to breastfeed afterwards? So this was something that actually really held me back from getting this done for, for a while. It was something I was like, well, I want to be able to breastfeed. I don't want, you know, to impact my future kids' health. And then I realized, why am I sacrificing my health for my future kids' health who don't exist yet? and for all I know, I won't be able to breastfeed anyway. A lot of women can't. There's just, you can have issues with breastfeeding whether or not you have a breast reduction. And I asked my surgeon about this a lot, and she said that she does her best to, she told me that she does her best to preserve the glands and the parts of your breast that produce milk, and not cutting out milk ducts and all of that. I'm not an expert on this, so that part this is all I know. So obviously I'm not pregnant, haven't had kids yet, so time will tell on that one. So I'm not really sure if I will be able to breastfeed, but personal choice, you can do what you want with that. Oh no, my phone is getting iOS 14, so I can't look at the questions, damn. Okay, let me see if I can find them on my computer. I know I've been speaking for a while, but now I'm going to actually tell you about the actual operation and the surgery, staying in the hospital, all of that. Your length of your hospital stay is going to depend on where you live, how social security and like insurances work in your country. In France, and I believe in a lot of European countries that have social security, your breast reduction will qualify to be reimbursed fully by your social security plan if they take out a certain amount of tissue from each side. In France, I believe 200 grams of tissue per side. It counts as being what they would call a réparatrice, so a surgery that repairs your body. So essentially non-cosmetic surgery. This will be covered by your insurance, and therefore you can stay in the hospital. I stayed in the hospital 5 days after my surgery. My surgeon requires / requests all of her patients to stay at least 3, if not 5 days. I stayed 5 days because I don't have the best circulation, so I had the drains in as well. So this is like getting ahead of my story, but anyway, I was very faint and a little bit fragile afterwards, so I stayed 5 days, which honestly I'm so thankful for. I would have not enjoyed being home without you know, the hospital bed that can like mechanically incline you, all of that. The day of the surgery, I went with my mom. I was kind of nervous, but not that nervous. Not as nervous as I would have expected. I did get more and more nervous as, you know, you get closer, you start taking your little like pre-surgery medicine and all of that. Yeah, I remember the surgeon came in to like draw on me, which was kind of weird. And that's when it kind of got real. Like I went to the bathroom and I saw myself with all the writing, and I was like, okay, like this is kind of a nip tuck moment, but anyway, then, you know, like they wheel you in. I had never had surgery before, so I was mostly worried about the anesthesia and how that would feel. It went great. Like there wasn't any issues during the procedure. I think the procedure took about 2 hours, maybe 3 hours. And so then I woke up and in my room, and that was like, I was really fuzzy, so I don't really remember a lot. I remember kind of waking up, and then I just remember feeling like I couldn't really breathe. So that's one of like the worst feelings. It wasn't due to like anxiety or anything, it was just the pressure of the stitching and all of that, like on your chest, right? Because it's like where you breathe in the hospital. So after so when I woke, oh my god, this part is like, I have so much I want to say. So when I woke up, I had the pressure on my chest, and so one of the things, so depending on your surgeon, you will have drains or no drains. So drains are little tubes that are attached to your boob and drain out extra fluid. So this is actually really good for helping avoid huge bruising, infection. There's some really bad stories online of like things like reopening because of like the juice. I don't really know, like this. I'm very happy I had drains. That's like all I'll say. But because you have drains, I could not stand up. Like I could not get out of bed without 2 nurses coming to help me. I could barely sit up. I had a lot of issues with circulation. I passed out like twice. Every time I had to go to the bathroom, I would faint. So the hospital was not fun, and that is why I am very thankful to have been in the hospital and not home trying to have like my mom help me with that. Like I was really thankful to be with medical professionals. Then so I stayed 5 nights. First few days were rough. I didn't handle the anesthesia very well post-op, so my stomach was really upset from it. I have like a phobia of throwing up, so I had a panic attack because I was nauseous. So then I had a really bad night where I had to like ask for like extra nurses to come, and because they wouldn't give me anything for the nausea and like the anxiety. So finally like the head nurse came and she like calmed me down and gave me medicine. Like, so essentially it's gonna be a bit of a bumpy road. Like don't expect to go into this being like, oh, I'm just gonna have my boobs done and go home and it's gonna be great. Like no, like it is surgery, it is somewhat invasive, like you're going to be in pain afterwards, but that does not mean that you shouldn't get it done. I'm not gonna lie to you and say it doesn't hurt. Like it hurts like hell. I personally don't think I have a very good pain tolerance. I never broke a bone or anything, so I don't have any frame of reference. I will just say it was the worst pain I've ever had. Every movement that you make will hurt for the first 2 weeks more or less. I can also do a video on post-op care. I don't think I'm gonna put all of it here because it's like a lot of information, so let me know if you want a part 2 to this with like all of my tips for after the surgery. But yeah, because this is gonna already be really long, I have a feeling. But anyway, all right, let's get into the Q&A. Someone asked, what was the most uncomfortable part of it all? So definitely the first 3 or 4 days after the surgery. I was in a lot of pain. I was very nauseous. I couldn't eat. I was also jet lagged because I did just come back from the US, so don't do this when you're jet lagged. It makes it so much worse. But yeah, so definitely the first 5 days. But the thing is that like once that's over with, your recovery is actually quite exponential. So like I came back home the 5th day. The following week I was like still in pain, but I was a lot better. Like I could move around, getting up from my bed was easier. Yeah, like your recovery, like within the first month, you go from barely being able to move to being able to start going back to the gym. So the second question is, any problem with the scars? Are you happy with the results? So I was, again, very fortunate. My scarring went really well. So yeah, so obviously I'm not showing you my whole boob, but mine went quite good. I'm not going to show you my nipple, obviously, but I'll show you underneath. So this is my scar now. So this is 2 years later, right? So as you can see, like you can't see the one that's here. It's right here. You can barely see it. And then the one underneath is still a little bit pink, but you really can't see it. It kind of, to me, it just blends into the fold of my breast, so it's not bothersome at all. And am I happy with the results? I'm ecstatic. That's why I'm making this video. I really recommend anyone who has pain in their back, is uncomfortable with the size. It was just dumb things, but like for example at the gym, you know, there's like the rowing machine. There's a machine where you're like, there's a thing that you press up against like this, and then you take the weight, like the thing, and you do this. I could barely reach the things for your hands because my boobs were in the way. Like little things like that where it's just uncomfortable. Like buying coats, it's so uncomfortable. Buying bras, oh my god, like don't even get me started. Next question is, did your breasts look larger than you thought after your first week of surgery? So actually not really. So I remember, so I asked for a large C because at the time I didn't actually mind the aesthetics of having large breasts. I was never self-conscious about having a big boobs. Like I wore tight shirts. I was not trying to hide them. And I was worried that I would not recognize myself if I had really small boobs, like if I went down to B. So I asked for like a C. And what's the question? Oh yeah, so with the swelling. So essentially what's kind of fun is that when you first come out of surgery, they're really like when you first come out, the stitching part, which is like the lower part, is very tight. So essentially it looks like you had a breast augmentation. Like my boobs were like this for like 3 weeks. And so they were very like perky, which I had never experienced like since I was maybe, I don't know, 13 or 14 when I first started getting boobs. So like it was kind of fun. The swelling went down, I want to say within 2 months. Yeah, starting like third month it was better. They were very kind of tough to the touch at first, very tender and just like swollen. But yeah, it wasn't like it wasn't like a raisin that shriveled down. No, it was just like they were very taut, and then they kind of, what they call settling, they settled down to like where they're supposed to be. Like I had literally boobs like here, so like they went down to normal. Okay, next question. After your surgery, do you still experience any issues with the appearance of your breasts? So I don't anymore. I'm very happy with my results. I was a little bit self-conscious, I think, at first about the scarring. Like I remember like trying on bathing suits that were stringy, and there was like one of my sides had a slightly larger scar, and I was kind of like, oh, like do I want to? And then I was like, I don't care, like it's fine. Like I had like maybe 20 seconds of ooh, especially now with the perspective of 2 years being 2 years out, I can't even tell that I had a breast reduction. Let's see, what's next? How did you choose your surgeon? What would you wish you had known before getting it? So getting my surgeon, I think I already answered. What I wish I had known before getting the reduction, I'm not sure. I feel like I knew that I was pretty well prepped about it. So nothing negative, maybe just how I wish I wish I had known about it earlier. I wish I had done this years ago. Honestly, if I had gotten this done maybe after my freshman year of college or sophomore year, I feel like I would have enjoyed college maybe even more. I know it's like a big leap because obviously like how does your appearance affect your like experience of something? I think I would have felt a lot more liberated to like try out for sports in college, you know, maybe even start going to the gym earlier. And also, yeah, clothes. Just it would have been so much easier for clothes. I wouldn't have had to save up like $100 to get a new bra, like all of the kind of more superficial side of this, I guess. And then also just the pain. Like I worked, I was a barista in college, so I was on my feet sometimes for like 4 hours at a time, plus school, plus working out, and then I would get home and just collapse and not be able to do anything because I was in so much pain. Yeah, there were even nights where like I had to take ibuprofen just to fall asleep because my muscles were so tense and so sore. 60 minutes. This is like gonna be the longest video ever. I'm so sorry. Okay, next question was, were you scared of intimacy afterwards? Did it hurt, and how was it in the end? So was I scared of intimacy? Not really. I mean, obviously I was a little bit apprehensive because I was like, oh god, now I'm gonna have to explain to people like this happened. But I think a good gauge is if someone reacts badly to you having had a surgery, having a scar on your body, and it's like, oh, like I don't want to date you because of that, they're a fucking asshole. Like you do not need that person in your life if they're so immature that they're going to be grossed out by a small scar. Like that means that they're with you just for your body and not for the right reasons. So obviously, like, you know, use your better judgment on that one. Like if someone is like, oh gross, okay, I guess I can get used to it, it's like, okay, bye, like get the fuck out, like you don't deserve to touch these boobs. Anyway, did it hurt? So obviously yes, it hurt, but as I said before, the recovery is very exponential. You get better a lot very quick. You just have to be patient with yourself on that. Again, if you guys want a recovery tips video, let me know. And I think that's all of, oh, one more question that I find hilarious. This comes from Tati, who is my best friend's younger sister. She asked if I ever experienced phantom boobs, so as in forgetting you got a reduction. So to me, phantom boob would be like, I think I have bigger boobs than I do, and then I don't. So I don't think I ever had phantom boob, but I did have moments where now, especially now, like 2 years out, I look at pictures of myself from college and I'm just like, oh my god, I can't believe my boobs are that big. Like it boggles like the mind to think that I had so much just tissue and mass in the front of my body. Oh, okay, so one last thing I want to talk about is how much they take out per side. So as I mentioned earlier, to get it covered by insurance, they have to take out 200 grams per side, which is essentially considered non-cosmetic. They took out 700 grams per side, which means they took out 1.4 kilos, which is almost 3 pounds. So, yep, 30 pounds of boobs was taken off of my body. So yeah, on that note, I think we're gonna end. But yeah, oh, and well, I'll just do another like little boob close up. But yeah, so this is what I look like now. So also I'm not wearing a bra right now, so like that's basically what my boobs look like, braless. That's the other thing. Oh my god, like being able to wear things without wearing a bra, like oh my god, the freedom. But yeah, so I think that's everything for this video. Let me know if you want a part 2. Write any questions below if you have that I didn't answer. And yeah, thank you for watching. My name is Gemma. Please like and subscribe. Yeah, and let me know if you want any other types of videos concerning boobs, concerning the reduction, insecurities, about like body insecurities, that sort of thing. I have come a long way on my personal journey in terms of that, so I would love to share tips and my experience with you. That's all. Bye. Thank you for watching.